The Caribbean Policy Research Institute, Capri, has released its report on vaccine hesitancy. The report explores the reasons behind the low uptake of COVID-19 vaccines in Jamaica and gives recommendations to increasing demand based on findings from a survey. Jamaica has the second lowest rate of fully vaccinated persons in the Caribbean region, trailing at 22%. Speaking during the televised presentation and panel discussion, Chief People Officer Christina Ivey shared who is typically vaccine hesitant.
This person is young, low income, did not finish primary school, is not religious, is not complacent, but is risk averse and does not trust the government or the vaccine. We can further break down the profile of the vaccine hesitant. The survey uncovered that 18 to 24-year-olds were the most likely to be unvaccinated, with nearly 70% of them having not taken the vaccine. This may not be due to any intrinsic difference in age categories, but to their sources of information. Younger people are more likely than older people to get their information from social media, where conspiracy theories and anti-vaccination propaganda thrive. We also found gender was not an important determinant of vaccine hesitancy in Jamaica, unlike many other countries. Education was, however, a critical determinant of willingness to be vaccinated. 46% of persons with a bachelor's degree were vaccinated, compared to only 33% of those who did not finish high school, and 23% of those who did not finish primary school.
The study highlighted the lack of safety information of vaccines, the inconvenient location selected for vaccination, and the lack of trust in the government. Health and Wellness Minister Dr. Christopher Tufton, who was a member of the panel, said the findings are interesting and will ask his team to review the document. He acknowledged it is unfortunate that the vaccine take-up rate is well below what it should be and expanded what he thought was a key reason for this.
I think the timing issue is important and perhaps, I would have certainly liked it to be more included in the process, because the perception around the vaccination program in the early stages of COVID, when the vaccine at that time was not actually available, when the risk was perceived to be highest, people had significant fears, but the vaccines were more concentrated into parts of the world, the developed world. To my mind, created a missed opportunity for take-up for us. Later on, as the risk became perceived as not as intense, and the noise around vaccination and the anti-vaxxers, and even in the medical fraternity where there were mixed views, it created a trust issue, not just among the policymakers, but generally speaking.
When asked about his thoughts of a lack of trust in the government, Mr. Ian Steen, PAHO's representative to Jamaica, had this to say.
Certainly, trust is going to be a factor. And the trust in the vaccine, the trust in authorities, is something that we're seeing across a broad range of countries, not just in, as you've seen here in Jamaica. So for us, the issue is we are looking at how there is this change in what we would call the social contract. Right? Your obligation as being a part of society is building in a part towards the public health approach. And so that, I think, marries with this issue of trust, because I think as we've seen over the past several years in many different places, in many different countries, that this issue of a belief in what has been a traditional approach, a traditional source of information, has changed with the new information age that we have it.
The report can be found online at capricaribbean.org.